He said so. Good morning. I'd like to call the Human Resources Appointment and Equity Committee to order. Can we have the roll call, please?
Calling the roll, Ms. Conwell.
Here.
Mr. Gallagher. Mr. Gallagher is absent. Mr. Germana.
Here.
Mr. Miller.
Here.
Ms. Brown.
Here.
There is a quorum.
I'll make a motion. I know we don't need to excuse during committee meeting for Councilman Gallagher. Is there a second? All in favor say aye. Aye. Anyone signed in for public comment related to the agenda?
No, Madam Chair, no one has signed in.
All right. Chuck, were you here at the last committee? Because we're going to do approval of minutes.
I'm not sure. What date was that?
Yes, he was here.
All right. So if someone could make a motion to approve the minutes from our January 20th meeting.
Second.
All in favor say aye. Aye. Minutes have been approved. There's only one item on the agenda for today, and that is regarding our stop loss insurance. So without further ado, if you could read that into the record, please.
Resolution number 2015-0031, a resolution making an award on requisition number 32491 to Reliance Star Life Insurance Company, doing business as Voya Financial, in the amount not to exceed $2,485,909 for stop loss insurance services for county employees and their eligible dependents for the period 1/1/2015 through 12/31/2015, authorizing the county executive to execute the contract and all other documents consistent with said award in this resolution, and declaring the necessity that this resolution become immediately effective.
Good morning.
Good morning.
Ms. Durkin, if you could give us a little brief history on stop loss insurance. We do have new committee members.
Certainly. Thank you. Good morning. Lisa Durkin from the Department of Human Resources. Stop loss insurance is what some folks like to refer to as catastrophic insurance. As a self-funded entity, meaning we pay all of our healthcare expenses, we procure stop loss insurance so that after a certain dollar threshold, the company will that we buy this stop loss insurance from will reimburse us for our claims. So what happens is on any given employee or dependent of an employee who is has selected medical or prescription drug coverage through the county, once one claimant hits $300,000 in expenses, the stop loss insurance kicks in, and Cuyahoga County no longer pays for that claim, for the above and beyond on the $300,000. So stop loss coverage is kind of insurance for your insurance. It's once things get to a certain level, it kicks in and takes over so that we are not depleting our funds on the same claim. For 2015, we have gone with Voya. Voya is actually ReliaStar, who is the same company we had last year. Last year we had ReliaStar doing business as ING. They merely had a name change to ReliaStar doing business as Voya Financial. Our premium goes from $2,091,000 in 2014 to $2,485,000 in 15, and this is due mostly to the growth in our regionalized entities. They do also buy into this contract, and that is due to the growth. We also have increased our stop loss level from $275,000 per dependent or claimant to $300,000, and this is also due to the growth in the regionalized pool. We now can procure better at this higher rate. It still covers all of our major medical claims and prescription drug claims, but according to our reserves, this is a more efficient manner for us to procure the stop loss. So that is the story of stop loss. We do procure this annually. We have found that when you go out for bid for stop loss, all they're looking at basically is your risk pool and what has happened really in the previous 12 months. And it is to our benefit to go out annually, to our benefit merely on cost. Cost is the real telltale on stop loss, whoever can give you the best deal, because this is really just a relationship where they are reimbursing us for costs once it gets to a certain level. In 2014, we had 12 claimants that breached the $275,000 stop-loss level. Now, when you think about that, that's pretty good, seeing as we have, with the county, about 6,600 people, employees insured, and when you consider their dependents, that goes up close to 15,000 claimants. So having 12 people breach the stop-loss is actually a pretty good rate. The regionalized entities, I don't have that kind of data off the top of my head, but they are also doing quite well. So this is something that we procure on pretty much price alone. Our entire relationship with them is once that level is breached, they are reimbursing us for those claims.
All right, I'm going to open that questions up for the committee. Councilman Germain.
Well, thanks for the explanation. Now, you're saying once that limit is reached, then they reimburse. So that means if a claim reaches the last year 275,000, then they reimburse you?
To the chair, to the councilman, that's correct. So that we don't interrupt service, we just keep paying the claim, but then we file that immediately with our stop-loss company, and they just reimburse the county for the claims paid.
Anything
beyond the level.
Over
Correct.
275,000. Okay.
Beyond the level.
Because the way you said reimburse,
Sorry.
I thought, I didn't. Okay.
Right.
And these sub-entities, they pay their own
That is correct.
stop-loss
That is
amount. Okay.
Correct.
And, okay.
On that,
I'm just wondering, the amounts over that stop-loss amount, did these sub-entities, does the amount that's reimbursed affect the overall premium? I guess it does.
To the chair, to the councilman, actually, no. This is a product where we pay the $2.4 million, and that's it. If the claimant is with Cuyahoga County, then we are paying. If the claimant is with one of our regionalized partners, they are paying. And therefore, once the stop-loss level is breached, those reimbursements are being made to whomever is the one paying the claim, Cuyahoga County or the regionalized entity. The premium remains the same.
Okay, thank you. And then my last question, I think my last question. If this is a serious accident or illness that becomes chronic, they're on it, there's no time limit once the occurrence happens?
To the chair, to the councilman, that's correct. We have in the past, of course, I'm not intimately familiar with all the details of every stop-loss case, although they are, for the most part, we have had a chronic which has exited, but for the most part, they are something such as a lung cancer or something like that. And unfortunately, at some point, there is an end date to that and to those illnesses. So usually when we have claimants breaching stop-loss, you're going to see it in a year. Maybe you'll see it the following year, but then it does work off the books.
I guess my last question, if you don't mind, Councilman Miller, is there I don't see a limit. Is there a limit that the company's on the hook for?
No, sir. No, they are taking, this is the best gamble in the business, yeah, for us.
So it could,
Yeah.
there's no limit.
I like to think of this as the gamble in the insurance industry.
Okay.
Yes.
Thank you.
Yes, sir.
Councilman Miller.
Madam Chair, Ms. Durkin, you said that there were 12 that breached last year. If we in fact had paid all of that excess, how much would that have been?
To the chair, to the councilman, $1.8 million.
So it was a little less than the insurance amount for last year.
Yes, sir.
Okay. Second question is that since this contract is for the period 1/1/2015 to 12/21/2015, and we have not yet approved this contract, are we not currently covered? And if someone were to breach the limit at this time, would we be on the hook for that?
To the chair, to the councilman. So how it works is, pardon me, because of the industry standard of how you procure annually and use that year's worth of claims, you kind of enter into this agreement, and our committee and council has been kind enough to understand that sometimes on the medical contracts we come to you after the start date. But what it is the insurance company, in this case Voya, is basically waiting for the the signed documents, I'm sorry. And if someone should breach in that meantime, they're just waiting until they understand that they are in a contracting process with us. They understand that that is something then that they will commence processing payments on after they get the signed contract. I wouldn't say that we're not covered because there is that kind of contracting process and understanding in place. And because this is pretty much an industry standard that it happens like this, it is a retroactive type of activity.
Okay. And so essentially, if something happens in the meantime, they're still going to cover the excess?
Yes, sir.
Okay. And how many bids were received on this contract?
I'm going to have to get you that exact information off the top of my head. I want to say 3, although it could be 2. So I'm going to get you that exact information and email that to you.
Okay, so I'd like to know what other bids and what the amounts on those bids were.
Yes, sir.
Okay, thank you very much.
On to Councilman Germana's point, how quickly do they reimburse?
Sometimes they do research. So this is a constant ongoing process of one of our employee benefits specialists in our benefits department is basically working with our stop-loss provider all the time to make sure that the breaches that are covered and those expenses that have gone beyond that breach limit are being shipped to that stop-loss vendor. So, for instance, if the member is with Medical Mutual of Ohio, the person in our benefits office is working with Medical Mutual of Ohio and looking at those costs and making sure that when it reaches the breach, she's working with both Medical Mutual of Ohio and then Voya to exchange that information to get those covered. So it's an ongoing process of us showing them the expenses. Generally, it does take around, I'm going to say, anywhere from 3 to 6 months to get the reimbursement.
Madam Chair?
Yes, Councilwoman.
If I understood correctly, you said our numbers have grown with regards to I think you mentioned 200 to 3K or 275 to 300?
To the chair, to the councilwoman, yes, ma'am. We were covered at $275,000 for major medical and prescription drugs last year and have gone to $300,000 with this contract.
And what was that due to?
So basically what we're doing is we're taking the stop-loss breach amount and adding $25,000 to it and saying, okay, now where we used to breach at $275,000.01, now we're going to breach at $300,000.01.
It's like a cost of living or?
So how this was arrived at was kind of a combination of things. Looking at our stop-loss costs over the last year and several years, to be honest, we never look at just 1 year. although the procurement of this usually is based on your most current year. So we're looking at the claims analysis of the past years. We're looking at the risk pool that we currently have. We're looking at the aggregate of claims that we're seeing. And we're looking at the health of the fund and what our runoff claims are and what our reserve is. And we're saying, what is it that is the most efficient amount that we can stay at and procure it the most economically? And this is where we landed with that this year.
Chair, another question. The regional partners, are they considered when we factor in our stop loss amount?
To Chair the Councilwoman, yes, ma'am. The regional partners was a huge key in why we increased to $300,000 this year.
But yet they don't really get the benefit of our stop loss.
Oh, yes, ma'am. They have bought into this.
Okay,
So
all right.
part of the premiums that they pay when they buy their health care through our healthcare regionalization program, if they choose, is to buy also into the stop loss program.
Ms. Durkin, is there any administrative fees or cost when we change
No, ma'am.
with contracts?
No, ma'am.
Okay. And
One more question.
Councilman Miller.
Director, do you believe it would be useful for us to pass this on second reading suspension and get this contract fully enforced, or does that not matter?
To the Chair, to the Councilman, I always try to be respectful of the Council's procedures, and the Council has been good enough to understand that the medical contracts sometimes come after the effective date. And so I never really asked for that because I want to allow you all your full legislative process. However, I am appreciative when that does happen because it just does quicken things along for us, especially when we're working on a reimbursement basis.
Well, I think this is a routine contract that we do every year, and I don't think there's any issues. And so I'm going to make a motion that we recommend Resolution 2015-0031 favorably with the recommendation to council leadership that it be considered for being put up for a second reading suspension.
Second.
All right, Ms. Durkin, I think one final question for me, and I'll have you validate because you hear rumors around here. So if you could touch bases in regards to if it was true that the money was not available for this contract.
Oh, yeah. Yes, ma'am. So here's what happened. We have had kind of the perfect storm going on between our benefits department, the fiscal office, and so on. We had Dan Ritchie and Eleanor Haw, who handled kind of the fiscal end of the benefits with me, retire at the same time as we had several of our people retire or move to other departments from the fiscal department. So I think that what happened was we kind of had a hinky time, fully matching our budget up with our contracts this year. And I wouldn't say that it's anyone's fault. I think it's just something where we had people retiring and other people taking over, and probably communication was not as good as it should have been. Therefore, this contract that would normally be procured or encumbered out of the fully insured index code, we encumbered under the regionalized index code. And to be honest with you, we're doing, along with Sybil Haney and others in the OBM, we're doing a full kind of analysis of what contracts should lie there, where. And actually, I believe that we're going to be moving this to the self-insured index code quite soon. So it wasn't that the money isn't there. It's that I think during all of our exits and everything that we've had within the last 6 months in our offices, we've been looking at more efficient ways to do our budgeting and our fiscal work here. We've kind of moved things around and moved appropriation around. And then we were like, oh, well, okay, do stop loss here, and then because, we don't even want it in fully insured anymore, do it here, and then we'll move it to self-insured. You will be seeing a request for additional appropriation coming towards you for the self-insured budget, only because, again, we are switching those contracts around to have them more appropriately reflect where they should be encumbered. The other thing that you will be seeing coming to you are major medical and prescription contracts, new ones for regionalism on their own in the regionalism index code. Prior to now, we encumbered those contracts in self-insurance in the county and just put another suffix code on that contract, and we decided we don't want to do that anymore. And we had the opportunity this year with so much growth happening. We kind of were in a position where we didn't know quite what we needed to encumber, how much money we needed to encumber in the regionalized major medical and prescription drug contracts. We had Cleveland Heights come on, which brought 400 employees and their dependents. And now we have Euclid, who's very close to being complete, coming on. And they're bringing 400 more employees and their dependents. And that shot our regionalization numbers up double. So we knew we had to do something about that appropriation, so we've been holding off on that. At the same time as we're moving contracts around to appropriately encumber them in the correct index code, we waited on that, and we will be increasing that appropriation for those contracts and moving them over to our regionalization index code. So the answer is, it is not true that there was not the money. It is true that we have been switching things around and trying to really get a handle on what contracts should lie where. There are several index codes which we encumber things under. The most important being the one for self-insurance, the one for fully insured contracts, and the one for regional. And we'd really like to be correct in where we put these things and take the opportunity for, since, there has been a transition of people retiring and coming on board, and we wanted to take the opportunity to really review this and make sure we're doing this in the most efficient manner we can. So there's some growing room, there are some growth that needs to go on, and there's some annoyances that happens when you're doing that kind of efficiency making.
So how long will it take to complete the list of the correct index codes?
Sybil Haney has been working with us from the Office of Budget and Management, and I believe we are on track to finish everything by the end of March, if I'm not mistaken. Our increase in appropriation for self-insurance, I know, will be on for March.
You'll have to come up to the mic, sweetie, if you don't mind. State your name.
Hello, Sybil Haney, Office of Budget and Management. We do have an additional appropriation item on for March 10th, but I believe that's for the regional increase. But we are going to follow up, and as soon as the benefits office has kind of finished its internal kind of number crunching, we're going to follow up with an appropriation item for the self-insurance fund.
We had just sent that information, finalized that information, and sent it to OBM via email last week, so I understand if they don't have that scheduled yet.
Okay, and is there also, could you provide us, Ms. Durkin, with a list of the correct index codes once you complete that?
Certainly.
Thank you, Ms. Haney.
Madam Chair.
Yes, Councilman Germana.
Just a couple other questions occurred to me. I see that we sent out 25 RFPs, yes, and 2 were returned. Do we send these out, or are these sent out by people that request? Have 25 requested and we send out 25, or do we send out without having them request?
Chair to the councilman, yes.
There was only 2 returned, and I'm just wondering, since we're doing this under second suspension, is Sun Life contesting this at all? Is there any? Okay.
To the chair, to the councilman, we actually have a list. That 25 is a list that we send out every year.
Okay.
And we also advertise, so it's available to all. there's not a ton of companies that do the stop loss work, especially to this level, because we are a very large insurer. So we do send to those 25. That is our list. We might get some requests in there, but not often on this contract. So that was us.
I guess one other question that keeps just popped up. Now, this is dates back a little, but I knew there were some groups that were doing self-insurance for cities in the state of Ohio, offering that kind of coverage. Is there been any discussion about aggregating so that more counties and governments can aggregate contracts?
To the chair of the councilman, we are aware of, I am aware personally of kind of those purchasing pools. I'm aware of one larger one in middle Ohio to southern Ohio. But around here, I'm not aware of anyone like that. And our healthcare regionalization program and what we do is not really a pool. As I've said before, everybody pays their own freight in this program. And, if I'm in one municipality, I'm not paying another municipality's freight. I'm merely paying my own. So we haven't gone the pool route with this. So, and I said this last time, that's true on major medical and prescription drug. And until you get to the regionalized portion of stop loss, not county's separate, but on the regionalized portion of stop loss, we have actually kind of knitted the risk more together and the payment more together so that we can more economically and efficiently procure. Now, that being said, I am not aware of a better program for us to join into. And if I do say so, I work very closely with our consultants, Employee Benefits International, who I have found to be more knowledgeable and innovative. We did an RFP on our consultant services 4 years ago, and EBI came through heads and tails above the rest in their methodology and their knowledge of the full business of public sector and creating methodology that works best in public sector, their knowledge of the laws that we are mandated by, So we work together and we are never kind of satisfied with what we have. We're always looking down the road. So I'm looking 5 years down the road, 10 years down the road, and we have started discussing how we're going to behave when we're larger, because we're getting larger. I had said we have doubled our size in regionalism in the past 6 months. So I guess what I'm saying is to look at aggregating the stop loss. I think we're going to have to see what happens down the road, how large we get. Right now, in the manner in which we project, we look at our projections every year, and aggregating was not, on the county side, is not cost effective right now. On the regionalized side, they are pooled and it gets us a little bit more economically procured. So that's where we're at. The aggregate, the purchasing of stop loss on aggregate, not per person, has really not worked out for Cuyahoga County economically because we do project our expenses so well. We have such a stable risk pool, which is obviously why we can procure for the municipalities so well and ourselves so well, that it is, especially after, 10 or 15 years, you can really predict what it is. In the last 2 years, we have not, I believe that we have been within 1% of ourselves projecting what we're going to be. So to buy on an aggregate level, we'd have to miss our projection by so much that it would have to make it worth it, and we have not. Nor do I hope we ever do. So until such time as our size mandates aggregation, which it's kind of sort of starting to do on the regionalized side, but not on the county side, then we kind of have to keep going as we are and checking it out annually and seeing where we're at, I guess is the easiest way I can answer that. It's sometimes such a theoretical business, you can get lost in all of that translation, I know.
Okay, thank you.
We had Sun Life insurance in 2011, didn't we?
Correct.
Okay.
And at that point, they were calling themselves Sun Life. Or I'm sorry, that Sun Life was the other
Right. We started out
company.
with someone
That was the
different.
Canadian company, yes.
And how, I think my final question, how do we arrive at the amount of the contract? I know you stated earlier it was actually more than $2.4 million. Was 2.9 last year?
No, ma'am. Last year it was $2,091,000.
Oh, okay.
So this year it's up to $2,485,000. We do, again, we put out a request for proposal and we get those bids and then we negotiate from there. So, so we are negotiating our best rates.
Okay. And since you mentioned about the growth of the regionalized benefits, or the municipalities that will buy into that, I'm just trying to think, when we started that, it was 2012, so I'm thinking, if I'm correct, that we've added maybe about 4 municipalities per year on an average.
So regionalization actually started in 2010, and it started with the land bank. As Councilwoman Brown reminded me, it started with the land bank, and it didn't grow very quickly by design. Obviously, you want to enter into anything like that very pragmatically. So I believe in the second year, which was 2011. So at the end of 2010, we had people buy in for 2011, but I think it was 3. I think it was Glen Willow, Walton Hills, Olmsted Falls, right, small entities buy in. So that was the first year. For the second year, we sat down and we really looked at what are we offering. We were keeping it small. We were actually advertising it to the communities as small. And we said, well, let's look at our methodology, the manner in which we underwrite, the manner in which we are, coming up with ratings proposals to the size, to the methodology. And we agreed that, look, we were completely, solvent and reserved in all of our funds. Let's open it up a little bit more. When we did that, I will tell you, I think we popped up to 6 or 7 or 8 pretty quickly. So I would say in 2012, we brought on several real quick because we could open it up and do a methodology that didn't have us maintaining those smaller levels. But we were still having, the municipalities maybe weren't still as comfortable. It was a new program. They were hearing about it at all of their meetings and everything. But it takes time for folks to become comfortable with what it is the program's doing. Some didn't understand it. There were misperceptions going on and on all over Cuyahoga County until such time as the insurance industry took an increase and municipalities started getting renewal notices on their fully insured products that were almost doubling their costs in some cases. And then we started growing by leaps and bounds, and we're happy to do that and happy to help those municipalities out. It's a very rewarding thing to be able to do that. Then we also, at the same time, though, I will tell you what we really saw were some municipalities, Cleveland Heights is a good example, they came on, we really didn't save them any money coming in their first year, but what they were looking for was to stop the volatile ups and downs of their renewals, of their rates. So whereas the private market in a fully insured product for a municipality could see anywhere from a 10% increase to a 41% increase, I think, is the biggest one that I saw in 1 year. If they just, they don't want to put up with that anymore, they'll come into our program where we have, on average, less than a 3% increase for all of the years that we've been active. So, so that is, the manner in which the growth kind of happened. Mm-hmm. So,
I know we talked about getting larger at a committee meeting somewhere. Could have been into 2012 or 2013. Mm-hmm. It sounds like we're at that point.
Yes.
So, do you plan on a presentation for me and Mike soon, or for the committee, and how we're going to tackle that as a county? We're getting large. We're getting to the aggregate now. Mm-hmm. How we're going to pay for this? As we don't want to cut off municipalities for joining. Have we thought about that kind of discussion?
Certainly. What I can do is when I come to you in March, I believe it is, with those newly moved contracts on their own for regionalization, I would be honored to give you a full presentation on, the entire program.
So
and where we've been and where we're going and the methodology behind it. I would love to do that.
So the list of index codes should be straight by then.
Yes. Oh, yes, ma'am.
All right. Any further questions from the committee? Anything else you'd like to share, Ms. Durkin, at this time?
No, ma'am. Thank you.
All right. It's been moved and seconded for second reading suspension. All in favor say aye. Aye. Any miscellaneous business?
Thank you.
Thank you.
No, but I'd like the record to reflect that Mr. Gallagher is in attendance.
All right, as well as Ms. Chrissy. Any other public comment? Anyone signed in?
No, Madam Chair, no one has signed in.
Right. And so I have a little miscellaneous business. So how is it going with the, we got to bring this up. We got to spotlight this. How's he treating you?
We had a good Valentine's Day
All
weekend.
right.
How are you treating him?
Meeting adjourned.